Hello, thank you for joining us today. We have Herbert here. He is a veteran. He's been going through therapy at Sleep Solutions Centers. So we just want he and his wife Ellen actually to give a little feedback. He's about a month and a half into a 3-month protocol of care. And so tell us a little bit about your story.
Okay, I joined the Air Force in 1968 and was in civil engineering in the Air Force station here at McCoy Air Force Base in Orlando. Went to Vietnam for 1 year and then came back and got my education at Florida State University. I've been coming to the VA hospital or center at Lake Nona for a number of years, and 15 years ago they detected that I had sleep apnea and required me to try out a sleep PAP machine as the only therapy that was available 15 years ago. Now, I'm told by the sleep center that I probably am an outlier because I ended up using it every day, every night, and even when I took naps, even when I traveled, and it worked very well for me. But as I've retired and traveled more, I got to the point where I think it causes many congestive problems as it helped my sleep apnea. So I looked for a different solution. And after another sleep apnea test at the Lake Nona Sleep Center in Lake Nona, I was referred to Dr. Griffin at Sleep Solutions. And I've started therapy as well as a sleeping device or an oral device. Mm-hmm. And the oral device over the last month has increasingly worked better and better and better. And I can't even tell you how much happier I am to have ejected the CPAP machine and gone to this oral device. It's changing, between the therapy and the oral device, it's really changed my sleep pattern, and I'm sleeping much, much better. I'm getting much more used to it, but it takes a while. It was a little uncomfortable the first week, less uncomfortable the second week, and then more comfortable
Let you show it.
on week 3 and 4. Yeah. And this is what the device looks like. I know it looks like the Terminator draws. But in any case, you want me to put it in?
If you want, flip it over.
Oh.
Because, yeah, if you want to put it in, you can.
And it's pretty easy to put in, and it once you get used to it, it's as simple as this. And I'm done.
You're done. Yep, exactly.
I wear it all night. Take it out in the morning, clean it, and I soak it in water and then clean it, and it's ready for the next use.
Yeah. So your apnea when you came in was severe. You stopped breathing 42 times an hour.
Yes.
And that's basically at a Medicare grade of like 4% desaturations. A lot of the other standards overall for some other insurance carriers and American Academy of Sleep Medicine actually go off 3% desaturations. And so 42 at a 4% is actually more severe at a 3%, obviously. So you have definitely, very severe apnea there. Now, when you've transitioned off of the CPAP recently, the key things that you were noticing, lack of congestion or...
That's been the biggest change. I have allergies, and so I had a lot of allergy issues as well. But even though I lavaged my nose and also used saline solutions, it didn't completely go away. And once I got off the CPAP machine, I noticed that a lot of that congestion completely went away. No sneezing, a lot less nasal drainage. And I think in combination with the additional therapies that I'm getting here from Dr. Griffin, it's made a huge change in my ability to breathe at night. And so I told Dr. Griffin this morning, I am not going to have to. I'm just not going to go back to that. And that was my whole goal in the first place in coming here.
Yeah, and that's something that we're going to be updating for you. So you're, again, about a month and a half in. We've been doing follow-up visits. We'll talk about some of these additional therapies that you just went through, or going through, I should say. But we will be updating your sleep test pretty much the last week of the year. So that's going to be the telltale sign as far as your amount of improvement, because we're going to test you with the device in your mouth and then without the device in your mouth. So we're going to get a new baseline study. Because you've gone through these adjunctive therapies, we're addressing more of the root cause with those. But before we jump into those, Ellen, what have you seen as far as your experience? Because you have a background, you have dentistry and respiratory therapist as well, right? So you kind of see the connection.
I was a dental assistant long time ago, and then more recently, respiratory therapist. We've been married for 53 years, so I've slept next to this man for all that time. And I've seen, for one thing, I was surprised at his acceptance of this device when they meaning the VA, when it was recommended that he consider the oral appliance for sleep apnea. I was thinking, no, Herbie, you are severe. You are really a severe, have severe sleep apnea. And they did the test, and it came back severe again. I was really delighted that he had such acceptance of this and the compliance. He went through the regimen of dental hygiene, cleaning his teeth really well every night. That's one thing I was honestly concerned about. He uses it when he takes a nap, and which is every day more or less. And at night, I've seen an improvement in his snoring. I'm glad I don't have that machine, listening to the machine when the mouthpiece would come displaced. It was a big blast of air, and I have to shove him, and he shoves back at me, trying to wake him up so he could readjust himself. I'm just delighted that he's so accepting and that he seems to be doing very well with it. Also, I'm looking forward to the travel aspect. You can't believe how many times I end up carrying this big bag with the sleep machine in it, because he's off parking the car or checking on something. I don't mind helping him, but I don't like having that extra weight of something to schlep around. Then when you get in a hotel or in a cruise ship, which we like to travel on, if he forgot to bring the extension cord, then that's a major undertaking to try to find the extension cord. So I'm glad of all of those things.
Yeah. That's wonderful, and congratulations on so many years of marriage.
Yes.
That is phenomenal. Yeah. What's your secret?
Just luck. Blind luck. Finding the right person.
What's your secret?
Right person at the right time.
Yeah, exactly. Serendipity.
We each have our individual lives as well, and hobbies and friends, and so we don't smash into each other's lives and try to discourage.
Yeah. That's wonderful.
One another.
That is wonderful. So, and you have an international trip coming up.
Yes.
Where are you headed?
We're going to be in Asia on a cruise ship for 3 weeks, traveling to
Vietnam, Thailand, Vietnam, Cambodia, Hong Kong,
Singapore.
Wow. Yeah, that's going to be wonderful, and that's at the first of the year.
And that's in February. And
end of January.
And my whole goal was to get rid of my CPAP machine by the time that trip takes place, and so we're going to make it.
Yeah, you are going to make it. Again, we're going to have those follow-up sleep studies, and we'll go over that at the end of December and be able to go from there. So the importance of these adjunctive therapies, I want to touch on that a little bit. So especially with the severity of your sleep apnea, these traditional types of devices that you're using, they've been around for over 40 years, but they're literally only using the lower jaw as far as the bringing that forward for you. So that's pretty much the management aspect of what we're able to do, and we can only come so far forward with the jaw, especially how your teeth come together, because you're almost at like an edge to edge position there, so you don't have a jaw that falls back very much. So already your bite is a little more complex or different, and so that's why the adjunctive therapies are so important. We did, one of them is the DECA Quiet Night laser therapy. So this is a CO2 fractional laser that is the same exact machine that we would actually use to firm and tone and tighten the skin in your face and stimulate collagen there to reduce wrinkles and lines and sagginess of the skin. We just use a different handpiece and we use it inside the mouth on the soft palate. And your soft palate was elongated, your airway was restricted right behind that area, and we knew that was a highly likely area that was collapsing on you or obstructing your airway at night. So this has been phenomenal to firm and tone and tighten. What was you had your third treatment today. Based on your severity, I'm actually going to do a fourth treatment, but most people just need 3. So what was your experience like with this?
Well, I know the intensity was a little higher today, and so it was a little. I could feel a little bit more than the first couple of therapies, but I know that it has done a great adjunct to the device itself, and even though there's a little bit of soreness, and I know that's going to go away in a couple of days, I think that it's really working, and so I think without the therapy, this wouldn't be as successful. I'm glad that I
Exactly.
moved forward on therapy as well.
Exactly. Yeah, we recommend warm salt water to gargle at night after the therapies. We do increase the wattage just a little bit each time, and so you were on the highest wattage today, basically. So initially, you're probably feeling a little scratchiness.
But it's not
tingling.
intolerable.
Yeah, it's not. No anesthetic. I mean, all the procedures we actually do here are non-invasive, and so we don't need anesthesia there. And then you have a lozenge to use when you leave today, so that's going to help soothe as well too.
Right.
But if you need a little salt water tonight, that's going to help you bounce back quickly. It's usually not sore for more than a day or 2, so minimal, very minimal in regards to that. Another therapy that we did was our high intensity laser therapy. We call that HILT for short, but this therapy is actually an Nd:YAG laser. So this is CO2, this is Nd:YAG. Different wavelengths and different things that we're treating. So this laser treats inflammation, and we were primarily using that around the sinus area because you had a lot of sinus inflammation there. So helping reduce that with the laser technology. And what did that experience feel like?
Well, there's momentarily a discomfort as it's being lasered, but once it's done, it stops. It's going away completely. I can't feel anything right now. So that's really minimal. Minimal pain.
Exactly. So and it's a focal point of about 5 millimeters. So it's a very small focal point of laser. So and it goes in to basically stimulate the hemoglobin. So it's going to the red blood cells and drawing in those to help heal.
You also applied it to my nasal.
Yep, I used it in
my
your
nose. And I didn't feel anything when you did that.
Yeah, exactly. It's just a little heat. Depending on the setting that we're using, it's just a little warm to the tissue, basically, in regards to that. And then the other therapy that we did was nasal release therapy. So nasal release therapy is a balloon procedure we use in the nose, and that helps to mobilize the bones of the mid-face and skull as well, too. And that's basically helping improve the cranial rhythm in your body and get things back in sync, and it's kind of like resetting the autonomic nervous system as well too. So what was that experience like?
Well, again, it's momentary. When the therapy is being actually administered, you do feel some discomfort and a slight amount of pain, but not an intolerable amount. But once it's over in each cavity on both sides, it's done, and you don't have any lingering discomfort, and it does open up those nasal cavities. I am breathing so much better at night.
You just had it now today too, so you could probably feel right now
Exactly.
the difference of how you're breathing.
It's probably as much of a contributor to my improvement as anything else that you've done.
Yeah. When we were looking at your CT scan, again, your nose was restricted, you had inflammation in the sinuses, your soft palate was elongated, the jaw and the tongue as well too. So basically that's why we're looking at the comprehensive nature of everything, because again, a 50% success or improvement with these devices alone is considered like a good result, basically, for most people. And then addressing with these other things, we really want to get you into that normal to maybe very low mild range, if any, apnea remaining. And so that's what we look forward to seeing.
I'm going to look forward to that test
Yeah.
at the end of the therapy.
I know, me too. So stay tuned, because we'll come back and share what the results will be after that.
Yep.
And
We'll know in another month or 6 weeks.
Yeah, exactly. So, And lastly, also happy Veterans Day, belated Veterans
Thank you.
Day, Veterans Week. Yes, thank you for your service.
And happy Veterans Day to all of you that
Yes,
served.
absolutely.